In this video, we're going to talk about kind of basics of diagnosing viral infections. Diagnosing viral infections is an interesting concept. When you think about viruses, they basically fall into one of two camps. Viruses that you really, really need to diagnose because it's some sort of epidemiologic or public health concern, and viruses that you'll almost never diagnose because they're so self-limited. So an example of that would be like the cold virus. Nobody goes and does PCR really on rhinovirus. But for instance, you would do PCR on a patient you suspected had the human immunodeficiency virus. So we kind of take this viral diagnosis as a as needed basis, and you need to think about the reasons why you might do tests to diagnose a viral infection. So why do we collect data regarding viral infections? Well, the first would be to confirm a diagnosis. So a good example of this would be cases of viral encephalitis or meningitis. So when we think about this, and we'll talk about this a lot more in your brain and behavior block, but once you know that you're dealing with a viral infection, not a fungal or parasitic or bacterial infection, there's HSV that can cause encephalitis, which we have a treatment for. It's acyclovir. Then there's all the other ones that can cause encephalitis. So for example, like West Nile virus or St. Louis encephalitis virus, or I don't know, Eastern equine encephalitis virus. All of these can cause encephalitis, but we don't have a specific antiviral that treats them. However, we want to know for sure that that's what's causing it, because you don't want to think, oh, what did I miss that maybe I could treat? So that's one reason. The other thing is to determine appropriate antimicrobial therapy, and that kind of gets at this as well. If it's HSV, we can treat it. If it's not HSV, but it is viral, we might not be able to treat it. The other thing you might think of here would be something like a patient with HIV. A patient with HIV, when you perform a test to determine their viral infection, you're going to find out how much they have, kind of their viral load. And you're also going to find out what kind of resistance factors they have. So because we currently, thankfully, treat HIV at a very high level, there are certain strains that are out in the population that are resistant to some of our medications. So you don't want to take your patient and put them on an antiviral that they are resistant to. So you need to determine which antivirals will be best suited to treat that viral infection. You're also going to want to check how well the patient is doing on that antiviral drug. Is it actually reducing their viral load? So that's another reason we might do this. Another thing you can do is you can define the course of the disease. So there are a lot of tests that we can do. And we want to know how long will our antivirals be effective? Are they still being effective? How far along is this patient in their infection? So we can determine, kind of looking at viral load, are they clearing the virus, or how much virus is still present in the patient? These can also be useful data epidemiologically. I think a great example of this is influenza. So every year during flu season, people go and get rapid flu tests, basically to find out, do I have the flu or not? That data is then shared across public health organizations. And part of the reason for that is so that we know what strains of influenza are currently circulating in the population and therefore might need to be included in next year's flu vaccine. So that epidemiologic information is important. And then the other thing is so that we can educate ourselves. We know what viruses we're looking for, what kind of syndromes different viruses cause, and the timeline at which these viruses progress. All right, so you've decided that you want to diagnose your patient's viral infection, and you're certain it's a virus infection. So how can we actually diagnose it? We have a couple of different ways of doing this. The first is the cytopathologic effect. You'll sometimes hear me or Dr. Poole refer to this as CPE. These are basically cellular changes that we see in cells when a virus replicates in it. They kind of leave a little signature. The next thing is detection of virions. Can you actually detect the viral particles in the culture, because that's basically what the term virion means. Um, Next, can we isolate and grow the virus? If we can take the virus from somebody's blood and place it on some host cells and then grow more of it. You can also detect and analyze certain viral components via the glycoprotein or the genome. So this obviously by some form of PCR. The last is serology. So can we detect antibodies in the patient's serum that are specific for the virus? Serology can be a useful tool, but as you'll learn when we study immunology, it doesn't always tell you the whole story. You need to look for changes in titer. And titer is the amount of antibodies present within a patient's serum. There are a lot of molecular and non-molecular tests available for identifying viral infections. The first and probably most straightforward, but often the most difficult, is cell culture. In a clinical lab, a specimen might be inoculated into a battery of cell lines. So, for example, HeLa cells. And then the ability of the virus to grow on these specific cells provides us with information. So, for example, it gives us its tropism. Is it able to grow in human cells only, or can it also be grown in mouse cells? Is it able to be grown in hepatocytes from the liver, or can we only grow it in endothelial cells? That tells you where you might find the infection within the patient. It also will help you identify its cytopathogenic effect, or CPE. And this is another form of basically looking at cytology. So this is identifying those prototypical changes in host cells that are associated with specific viruses. Many viruses have a characteristic effect that includes changes in kind of the cell morphology, cell lysis, and some examples I'm showing here, vacuolation, which is basically the formation of vacuoles in or around adjacent cells. We typically associate vacuolation with dermatopathology. So that's where we'll talk about that more. But for example, syncytia, which I'm showing here, these are basically multinucleated giant cells. So they form by basically viral fusion of individual cells. So the virus infection itself led to the cells kind of fusing together. We see this in a lot of different viruses, including paramyxoviruses, parainfluenza, as well as herpes viruses and HIV. Another thing you might see are inclusion bodies. These are histologic changes in the cells that are caused by viral components. So when you see an inclusion body, it's basically that there's too much viral components within the cell. They can be intranuclear or intracellular, like intracytoplasmic. Intranuclear inclusion bodies can be found in large cells within CMV infected cells. So like a characteristic owl's eye structure appearance, or a Cowdrey type A, like I'm showing here with HSV, in single cells or large syncytia and herpes virus or varicella virus, which causes chickenpox. So we see these specific changes, and these are all part of the cytopathologic effect. Okay, you can also detect viral proteins. You can do this in a couple of ways. You can certainly do it by some form of immunofluorescence or immunohistochemistry, which I'm showing here. So this is basically just a fluorescent tag for a viral protein. It's showing up green. This is the same thing, just using chemistry instead of fluorescence. Basically, you've got a reference antibody against a known antigen or protein for that virus, and you stain it, and then you have some sort of indicator, either fluorescent or chemical, that will then show up. You can also detect this using a Western blot, right? So that's an excellent way molecularly to detect viral proteins and see their presentation there. The other thing you might be able to do here would be an Eliza. And that's actually something that's done somewhat rapidly. This is an enzyme-linked immunosorbent assay. These tests look for specific viral antigens and then produce a color change. This is what occurs with like a pregnancy test at home, which is just looking for the presence of HCG hormone. So you can apply that to something like a rapid flu test, which is just looking for proteins that we associate with the influenza A and influenza B viruses that are given in clinic. You can also detect viral genetic material. So you can do an electrophoretic pattern for RNA viruses like influenza. Lengths of DNA viral genomes like CMV can act as patterns for viruses. And there's a lot of different ways you can do this. DNA probes, PCR or RT-PCR is probably the most common method for detecting genetic material for viral infection. You can also do a southern blot or a northern blot for these as well. And then lastly, serology, like I mentioned, this is going to determine the antibody response made by the host to the virus, or in your case, the patient. You can use it for identification of viruses that are difficult to isolate and grow in cell culture because of, any number of reasons. You can also use it for chronic or long-term disease. So for instance, like HIV. It can be useful to serotype the virus, but on average, it takes anywhere from 2 to 4 weeks for a good serologic response to be made. So you have to kind of take this with a grain of salt, depending on how early on in infection you are. And that kind of brings me to kind of the closing point here. For all of these tests, you need to consider your specimen collection. So what do I mean by specimen collection? Um, you need to think about the patient's symptoms and history, including recent travel, season of the year, and a presumptive diagnosis to help determine the tests that will help you identify a viral agent and the type of specimen necessary to complete the test. Specimens routinely used for viral ID would include things like nasal or throat swabs, sputum, stool or rectal sample, urine, blood, and even cerebrospinal fluid. Um, Anytime you're collecting it, you want to collect specimens early, as often as you can, particularly during the acute phase of infection, because that's when virus is likely to be at its highest and why it's likely to be shed. So for example, respiratory viruses, like for instance, the flu, will shed for anywhere from about 3 to 7 days. And the shedding might lapse before the symptoms cease because some of the symptoms we experience in a respiratory infection are actually due to the cytokines we produce in response to it. So even though the infection is no longer really actively replicating, our body still has to calm down and stop producing those cytokines. Herpes simplex virus and varicella zoster might not be recoverable from lesions for more than about 5 days after the onset of symptoms. The flu test is actually most accurate only within a 3 to 4 day window of symptom onset. And that can actually depend on how quickly your patient actually comes in to see you. You might get a negative flu test. Doesn't mean they didn't have the flu if they've been sick for, say, 7 days. So when you collect it and how you collect it is really important. And we'll talk about that throughout as we go through cases.